Hey everyone, my name is JC Limley, and this is my Educated Citizen Capstone presentation. The public issue that I decided to research was lack of prenatal care in minority women. So in order for me to research this topic, I first had to understand what is prenatal care. And prenatal care is healthcare that you receive while you are pregnant, and it is about 13 to 14 visits after about 8 to 10 weeks of gestation of your pregnancy, where women receive ultrasounds, growth checks, check for fetal anomalies, and treatment of maternal conditions such as gestational hypertension, gestational diabetes, and following up with preeclampsia patients, placenta previa patients, etc. So the issue in the United States and as well in Omaha and even in our own community is that many women don't actually receive prenatal care. And the top 3 minority groups that I found that don't receive prenatal care in our community was Native American women, which made up 41%, non-Hispanic Black women, which made up 34%, and Hispanic women, which made up 29%. We found out that lack of prenatal care causes low birth weights and higher mortality rates in both women and the baby. So when I was researching this topic, I wanted to understand these minority groups a lot better, to understand why they weren't receiving prenatal care or why they feel that there's a lack of access for them. So I found out that many women don't receive prenatal care due to high costs, lack of transportation, long wait times, unwelcoming provider attitudes, fear or distrust of medical providers and nurses, lack of health insurance, and lack of social support. So why did I choose this public issue? I chose lack of prenatal care in minority women because I am currently working at Methodist Women's Hospital and I see a need for more culturally competent care. I have learned so much through this research on ways that I can be a better nurse for my patients, no matter what their race, ethnicity, or background. I also was able to find many resources in our community that can help these women. So according to the NMC Educated Citizen model, an effective communicator is someone who uses effective communication through using critical thinking to generate, connect, and organize in a written, oral, or nonverbal manner. So during my first experience as an effective communicator was during my clinical rotations on the labor and delivery unit at Women's Hospital. I was taking care of a 20-year-old Spanish-speaking patient whose baby was diagnosed with hydrops, which is usually a fatal condition in babies. The physicians and the nurses were trying to speak to her through the Marty interpreter, but I could tell that they were just more focusing on the Marty and not making eye contact with the patient. So I took it upon myself to just investigate her nonverbal cues, and I could tell she didn't really understand what was going on with her baby, as all of us were concerned for her and her baby's health. I decided to use some of the bits and pieces of Spanish that I was able to say and communicated with her, and I actually found out that her mother and father weren't here because her father was back in Guatemala taking care of her family members, and her mom had recently passed away. In this experience, I learned how important it is to pick up on your patient's nonverbal cues, no matter what language they speak, to further investigate what the patient may be feeling or dealing with. I also learned how important it is to brush up on my Spanish because I want to be able to talk to my patients without having to use the interpreter so that they feel more comfortable with me. I want to be able to communicate that and understand that they are in a safe place and they are in my care. This experience directly relates to my public issue of lack of prenatal care in minority groups because Hispanic women are known not to receive prenatal care because of the language barrier. They fear that because they don't know English, that they might not receive the right info or understand what is being told to them. I feel in the future I will still continue to learn Spanish so that I can make my patients feel safe and that they can trust me. Having this skill potentially increases other women seeking prenatal care. The second experience that I had as an effective communicator was actually in my job role as a surgical tech at the Women's Hospital on the L&D unit. I assisted in a C-section with a 19-year-old Hispanic COVID-positive patient who was very nervous about this procedure. She was looking around, looking at all of us in our face shields, our masks, our eyewear, our gowns, our gloves, double gloves, and I could tell she was very nervous. And nobody else seemed to be picking up on that because this was during the time when everyone was scared about COVID. It had just came out, so a lot of people were just frantic and not really paying attention to the patient. So I decided to go down on the side of the operating room table, and just tell her that I will walk her through step by step as we do them so that she could understand what was going on, because she was the only one in the room. There wasn't any visitors allowed at this time. And so I just wanted to make her feel like someone was advocating for her and that someone was by her side. So what did I learn from this experience? I learned how important it is to use verbal communication with my patients, especially when they're nervous and scared of the unknown. That's why I think it was so important for me to verbalize to the patient what was going on in the procedure, to make her feel like she could trust me and ask me questions. This experience, I believe, directly relates to my public issue because many women don't receive prenatal care due to mistrusting nurses and physicians. Using my voice, I want my patients to feel like they can trust me and that I'm going to advocate for them. I want to be able to make them feel comfortable as I take care of them on the labor and delivery unit in the future. I believe that this will increase women to receive prenatal care when they have encounters with me or other nurses who take the time to verbally communicate to them. Next is reflective individual. According to the NMC Educated Citizen Model, being a reflective individual is someone who engages in habits of inquiry that influence ways of thinking and actions. My first experience as being a reflective individual is when I reflected on the day that I read the Dale Carnegie book, which was How to Win Friends and Influence People, and how his points in his book could make me an exceptional nurse. The book talked about the importance of being genuinely interested in others and to encourage people to talk about themselves. I reflected this back to when I was in clinical and I would sit in my patients' rooms and just ask them about their life and their history. I wanted them to feel that they were more than just their diagnosis. Reflecting on these two situations, I learned how important it is to talk to your patients and how to get to know them on a deeper and personal level. And I felt like it's important as a nurse to treat a patient as a whole human and not just what they're admitted for at the hospital. So I feel like this experience directly relates to my public issue of lack of prenatal care in minority women, because many minorities said that they don't believe that nurses and doctors care about them. And so this skill in the future is going to help me as a nurse make my patients feel like they are heard, like that they can tell me their life story, and that I can ask them questions and they can tell me about themselves and feel comfortable to do so. I feel with this skill, I know that patients would be more likely to access prenatal care. My second experience of being a reflective individual was when I got to reflect about the racism that is still alive in today's society. I reflected on my own relationship with an African American male, and as well as clinical when I took care of a Hispanic woman. I reflected on the moment because I remember the nurse was getting mad that she had to take care of someone who didn't speak English. I just remember feeling very confused on what was such the big deal of taking care of someone who was different from her. So what did I learn from this situation? I learned that I need to change the way I act and think. I learned that I need to be a voice for my patients who do not feel heard just because they're not the same race or ethnicity as I am. I learned the importance of never judging patients based on their appearance and what language they speak. Learning how to advocate for women who are not the same race or ethnicity of me directly relates to my topic, because if more minority women felt advocated for by nurses, more women would receive prenatal care. So being an advocate for minority pregnant women could also increase accessibility to prenatal care by finding out what the issue is for the patient and finding ways to solve it, such as getting social work involved to help the patient receive transportation if that was the issue. According to the Nebraska Methodist Educated Citizen Model, the change agent uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems to develop culturally competence and to take an appropriate initiative to effect change. This first experience as a change agent took place at the Benson Baptist Church, where during clinical I got to take blood sugars and educate the community on what high blood sugar was and how they could modify their diet and exercising to bring down their blood sugars into a normal range. This experience made me realize the importance of nurses specifically getting out into the community to educate patients and reach patients who may not receive routine care by their physician. I learned the importance on educating underprivileged communities, and this experience taught me that I want to create change in my own community, so I started actually volunteering at the homeless shelter, which is called the Stevens Center for the Homeless. This experience relates to lack of prenatal care in minorities because, as my church says, we need to be getting out of our seats and into the streets. I believe that nurses need to be doing the same thing, going into the communities. I believe I can help women access care that they may not be able to receive by getting into the community. I could come up to the women who may need a checkup with their baby and do not have transportation to do so. Having mobile prenatal clinics in Omaha would also be a dream of mine, to reach many women in order to increase the number of minority women who receive prenatal care. My second experience as a change agent was when I attended a Black Lives Matter peaceful protest and got to see the importance of protests and how they can change the community around us. The next day at work, I actually had a coworker who was talking about the protests and said that, quote, "They're probably all guilty of some crime." I took the time to explain to her what it means, what the Black Lives Matter movement actually means and the importance of it. And after explaining this to her, she actually thanked me and said how she could be a more culturally competent nurse by hearing things in a different way that she may not have learned before. In this experience, I learned that my voice can promote change. I learned that it is important to stand up for what is right and to not be quiet. I learned that my voice can be used to advocate for many people. This skill that I learned in this experience is huge for lack of prenatal care in minority women, because I'll be able to speak up for minority women who feel that they aren't receiving proper care. I'll be able to educate team members as well on how they can become more culturally competent and to also speak up for others who don't feel that they have a voice. So in conclusion, this is my second journey through Nebraska Methodist College, and I'm soon going to be a double alumni. I've had so many great opportunities at this college in these last 4 years, and now all of these experiences have molded me into an educated citizen that is going to be able to effectively communicate to her patients, to reflect on situations, and to be the change in our community.